Well, I want to say welcome to everyone who is watching this live, and welcome to those and hello to those who are watching the recording. We're so glad that you are interested in learning more about enhancing your resume with clinical experience here at Case Western Reserve in the School of Medicine, and particularly within our Master's in Bioethics and Medical Humanities program. So I'll start by introducing myself. I am Dr. Leah Jeunnette. I am the director of the Master's in Bioethics and Medical Humanities program here at Case Western Reserve. I'm also the assistant director of education within our department for bioethics and medical humanities. And a final role that I fill within our department of bioethics is in conjunction with university hospitals. So I am also a clinical ethicist. So clinical ethics is near and dear to my heart. I actually did this master's program 15 years ago, and I was very thankful to be a part of it. And after the program, I went on to get my PhD in healthcare ethics, and I focused in clinical ethics. And I'm delighted to be back in the department years later and work with our students in the master's program, but also be able to do clinical ethics at the hospital as well. So just to quickly cover the agenda, we're going to talk just briefly about Case Western Reserve School of Medicine. We'll talk more specifically about clinical ethics. What is it? How do we define it? What are the topics we think of? And then we'll talk a little bit about our master's program and how clinical ethics is incorporated across our master's program, both in the curriculum and out of it. We'll talk very quickly about application process and deadlines, student assistantships and financial aid, and then leave time for Q&A at the end. Speaking of Q&A, if you have questions, feel free to submit as this presentation is going along for those of you who are joining us live. I will hold the questions till the end, but if something comes to mind, you're welcome to submit it early, and then hopefully we'll have time at the end to answer it. So just to give you a little bit of framework, Case Western Reserve University is located in Cleveland, Ohio. We have several schools here and colleges. Our Department of Bioethics is located in the School of Medicine. I think it's important to mention for ranking purposes, we are #1 in Ohio for medical schools. In terms of medical education, we're 24th in the US. And then in terms of research funding, according to the NIH data and the Blue Ridge Institute, we are 22nd in the country. I will say that, rankings mean all kinds of different things to different people. And it's not that we're trying to emphasize how excellent we are. While we do have excellence as part of our, core principle, I think it's important to note specifically the NIH funding. And what this says to me and to others is that we are heavily involved in medical research in our School of Medicine. It is a priority to us, and we are doing it at a very high level, which means our students have the opportunity to be involved in it as well, in all different ways. The other beautiful thing about the way that Case Western Reserve University is positioned and our different schools and colleges is that we can work across disciplines and we can work across the schools to collaborate on this research. And not only are we collaborating across the university, but we were also collaborating across the street and down the street with our local hospitals. And we'll talk a little bit later about our 4 teaching hospitals here in Cleveland. So the big question that often comes up is, what is ethics in a clinical setting? When we hear the words clinical ethics, what do we think of? And I will say for those of us who are in bioethics, who are in clinical ethics, this is something that we get asked quite often because those who are not familiar with this have really no reference point a lot of times for this as a term, and thinking about values and morals and ethics at the bedside, in the hospital, caring for patients and family and with medical teams. But when we start to describe the different areas that we can address in clinical ethics, it starts to be a little clearer to people. People are aware that there are discussions about do not resuscitate orders or advanced directives, issues of decision making. Can a patient make decisions for themselves? Do they have enough capacity to understand what is going on? We have lots of discussions about withdrawal and withholding of artificial nutrition, hydration, or even things like ventilators, topics of organ donation and transplantation, discussions of non-beneficial treatment. When we've reached someone's end of, treatment options, at what point do we say that treatment is no longer beneficial? And not just non-beneficial, but it potentially could be causing harm. When we start to describe it in these words, people start to better understand what we mean by clinical ethics. Of course, there are many more topics, things like resource allocation. We saw this during the pandemic a lot when it came to resource allocation, when it came to ventilators and hospital beds, and all of that falls under clinical ethics to a certain extent. So I want to give an example, and our chair and professor of bioethics, Dr. Mark Alicio, has a great example that he wrote about in 2003, and he continues to use when we talk about clinical ethics. It's a wonderful example of how we think about values in a clinical setting. And the case goes like this. There is someone who is a motorcyclist, and he is in a motorcycle accident, and it hurts his wrist, it hurts his leg. And in order to, the medical team essentially gives the patient two options. He can either amputate his leg, or he can take some tendons and some ligaments out of his wrist and move them into his leg, and we would be able to save the leg, but there would be some mobility issues with his wrist. And depending on who you ask, most people would say, well, of course he'd want to save his leg and have just limited mobility in his wrist. At least he would have his hand, his wrist, and his leg. But when you come to find out that this motorcyclist is a concert pianist, having full mobility in his wrist may be of higher priority and of higher value to him than having his leg. And so this is a great example of values can be different for different people, given their circumstances, given their priorities in life, given how they view themselves. And this is part of the complexity of clinical ethics, that what one person may put in high value, someone else may think differently. And so some of the take homes we think about in this particular case, but in clinical ethics in general, is that bioethics and medical humanities is considered a complex, value-laden issues. They consider these things as they emerge in the delivery and practice of biomedicine and life sciences. These kind of questions continually come up. And it's not that anyone in a particular case is the quote unquote bad guy. It's that they're complex issues and they sometimes conflict with each other. So one way of defining bioethics and medical humanities is that in the practice of working to identify, analyze, and resolve value conflicts or uncertainties and that emerge in the areas above. So we think about these things as we address them. And then lastly, it's important to study various approaches to bioethics and medical humanities because each approach has a potential to offer a different perspective or surface a different aspect of the complex value-laden issue under consideration. And think of it like viewing through different lenses. And this really allows us a greater understanding of where someone else might be coming from. A great example is people have different religious views, and their personal religious views may dictate how they approach healthcare decisions. And that can vary person to person, even if they identify as part of the same religious group. So there's a lot of things we think about in clinical ethics. And this is going to be relevant to anyone working in a clinical setting, not just those providing direct care. So why study clinical ethics and ultimately bioethics and medical humanities? And one of the ways that I think about this is because to answer this question, is because healthcare impacts all of us. It could be personally and it can be professionally. But because it impacts us, there are values and there are conflicts that are naturally going to come up and they have to be addressed. Secondly, we see constant advancements in science and technology that lead to ethical questions, ethical concerns, questions like, should we intervene? A big question that comes up in clinical ethics is what kind of values should inform policy and practice? And Can we ensure, or should we ensure, justice and respect for persons in a clinical or a research practice? Of course, there are many more questions beyond this, but these are just some of the big ones that we think about and we tackle when we study clinical ethics, when we study bioethics and medical humanities. Whenever we have a clinical ethics case come up for a specific patient or family or medical team, we're really seeking to include all of those who are caring for this patient, because we all have different perspectives and different priorities as we discuss these ethical concerns moving forward. So how does this ultimately enhance a career path? And we see this because bioethics and medical humanities, and even in clinical ethics, more specifically, it is an interprofessional and it is a multidisciplinary field. So when you ask someone who says they're a clinical ethicist, their educational background may be different from another clinical ethicist. There isn't one standard way to become a clinical ethicist in terms of education, but there is some standards that we think about that we'd like to see in their skill set, in their personalities, just like you have with other professions as well. For those who maybe aren't directly going into bioethics or clinical ethics, having this understanding can absolutely enhance the career path. So most of our students end up going into clinical professions or legal professions, regulatory or policy work. Most excuse me, most are not going into bioethics or clinical ethics full time, but rather they're thinking about how bioethics and medical humanities is going to enhance their primary career. We also have students who go on to academics, and we have a large number of students who are looking for discernment because they are undecided of their career path. And I think this is a really important thing to highlight. One of the ways that bioethics and medical humanities, and specifically clinical ethics, allows us discernment is because it is interprofessional and multidisciplinary. So our students are able to take advantage of meeting people from different career paths that have overlapping interests to better understand how that could apply to their own career path. I think it's a wonderful component of our program. So speaking of the master's program, so our Master of Arts in Bioethics and Medical Humanities, we will be celebrating our 29th year this fall. We're one of the first programs in the country in terms of master's programs, which is incredible. We have both full-time and part-time options. The majority of our students do the program full-time, so 1 year or 2 semesters. We also have dual degree options for students, whether it's medical school, law school, Master of Public Health, social work, or genetic counseling. Part of the way that we offer our program is through a customized curriculum. And so essentially half of our curriculum is required core courses, and the other half is electives. And this allows students to think about what their goals are in the program, both in the short term, but also in the long term for their career path. And they can identify the courses that are going to help them reach the goal they are seeking to. 2 big highlights of our program are our short-term study abroad courses. These are 1 to 2 week long intensive courses that are 3 credits students can take while they're in our program. Then a big highlight is our clinical ethics rotations. And this is where students can earn up to 160 hours inside our teaching hospitals. We're going to talk more about this in detail in just a few minutes. And the last thing that's really wonderful about our program is personalized advising. So as you're working through, how do I structure my curriculum? How do I think about study abroad or take advantage of the clinical ethics rotations? You have an advisor who is going to be guiding you through this process. I will also note the picture in the background is our most recent graduates. They had their diploma ceremony on Friday of this past week, and we are so excited for the next step that many of them are taking. And this is just a small sample of those who graduated this year. So I want to pivot a little bit to talk about the curriculum and kind of how it works. So we have our traditional program, which is by default what all students are taking. And then we have 3 concentrations that students can choose, whether it's medicine, society, and culture, research ethics, or health policy. And you can see that Foundations in Bioethics and Medical Humanities 1 and 2, our first semester of clinical rotations, and our capstone are required for all students. And then the rest is an opportunity for students, as we talked about before, to customize their career or customize the curriculum for their career path. For most students, they end up doing 2 semesters of rotations, whether it's through the traditional or the MSc. A smaller number of students either do research ethics or health policy, and their second semester of rotations is a practicum instead. So how do we think about clinical ethics within our curriculum and as a part of our greater program? So we have course opportunities. Our first thing is clinical ethics rotations. This is, as I mentioned, 160 hours in our hospitals. Again, I'll talk about that in detail in just a moment. We have a course called Clinical Ethics Theory and Practice. This course is taught by Dr. Mark Alicio. He really does a wonderful job with this course to think about clinical ethics topics in a way that is both the approaches and the theories that we use, the typical issues and conflicts that come up, whether it be capacity, informed consent, autonomy, justice, but then also covering more contemporary topics in the practice of medicine, whether it be issues of end-of-life care, topics like abortion, queer health. There's a number of things that can come up as clinical ethicists when we are at the bedside. And so it's a great opportunity to learn all of this through the course. And it is a mixture, of course, led by Dr. Alicio, of experts and clinical ethicists throughout the Cleveland area and sometimes even nationally. So it's a wonderful opportunity for students. And I highly recommend it for those who are thinking about a career in more of a clinical setting. We also have clinical ethicists that will teach in our classroom. So they may teach their own elective, or they may teach through the clinical ethics theory and practice or the rotations. And so you're going to get to hear from those who are doing clinical ethics work in the hospitals. As I said, I'm also a clinical ethicist. And so when I give a talk, a lot of times I'm going to bring cases with me because that's how I can illustrate the discussion we're having, is through a case, and help students work through and see how we approach clinical ethics in the hospital setting. Another opportunity through our courses is through our capstone paper. If you are interested in a clinical ethics focused topic, you of course can write your capstone about that. We've had a number of capstones over the years that have focused on that, and it's a wonderful thing. And then lastly, there are research opportunities. So our clinical ethics faculty are not just doing clinical ethics, but they're also doing research and writing and presenting, and students are able to collaborate with them and get involved in their projects as well. So this is the big focus of interest for a lot of prospective students and current students in our program, and that's our clinical ethics rotations. So as I said, students have an opportunity for 160 hours inside our teaching hospitals here in Cleveland. We have 4 teaching hospitals. We have University Hospitals, Cleveland Clinic, both of which are private hospitals, but they have quite extensive healthcare systems throughout the region. We have MetroHealth, which is our county hospital. It is a safety net hospital. And so we think about maybe different patient demographics there compared to maybe a private hospital. And then lastly, we have our VA hospital, our Lewis B. Stokes Cleveland Veterans Affairs Hospital. This VA hospital is the 4th largest veterans hospital in the country. So it is quite an extensive network and hospital options and outpatient care for veterans throughout the greater Cleveland area. What's wonderful is each of these hospitals has a unique focus in their patients, in the type of medicine they provide, and the demographics, in their priorities, and it allows for students to see a variety of options and opportunity within these healthcare systems. The goal is for students to spend 1 semester at a private hospital, so either UH or Cleveland Clinic, and then the other semester would be at a public institution like MetroHealth or the VA. While you're in these rotations, you are attending different types of rounds with teams. So this could be in ICUs or general floors. It could be interdisciplinary team rounds, or it could be consult teams. So for instance, there is likely to be a psych consult liaison service. So a patient is in the hospital for a medical reason, but they also have a psych diagnosis. And so the psych team will come in and see them as a consult for the patient. And you can go with them as they visit patients throughout the hospital to help provide care. Committees is the second opportunity for students. This includes ethics committees, IRBs, rehabilitation meetings, animal research meeting, transplant selection committee meetings. There's such a variety, and the different priorities of the different hospitals are very much apparent here. So for instance, both UH and Cleveland Clinic do transplantation of different organs. And so they have different committees that focus on that, whereas MetroHealth or the VA don't do transplants. And so you wouldn't see transplant selection committees at those hospitals. However, the VA has an extensive rehabilitation program. And so it's really interesting to see the committee meetings they have focused on that. And then the last category of opportunity in clinical ethics rotations is one-on-one with healthcare professionals. So students can visit patients, they can attend meetings, and they have direct time with healthcare professionals that understand ethics. These could be attendings, nurses, genetic counselors, social workers, chaplains. There's such a variety of healthcare professionals and allied health services that think about ethics within the confines of their job. And so it's important for our students to understand where the clinical ethics issues are coming from and how these healthcare professionals address them within their roles. So as we think about, everything we've talked about with the master's program, clinical ethics in general, I think there's kind of three questions we tend to receive. How has this program assisted students in their career goals? We have students that do this program and they go on to medical school, law school, which will then set them up for a wonderful career path. But we also have students who, as I mentioned before, are undecided. And by completing our program, and specifically clinical ethics rotations or a concentration, they really get to know what they're passionate about and how that can translate into a career path. And so I think that really can help students achieve goals, both short-term and long-term. And that kind of answers the second question, is how does it change career goals in any way? We have a number of students every year who think they're going down one path, and because of this program and the opportunities afforded to them, they pivot and think of a different path. I can think of students who for many years said, I'm interested in healthcare, I'm interested in medicine. They thought the goal was medical school, but through a program like this, they realize what they're excited about is policy work. What they're excited about is making a change at the systemic level or at a greater level than just patient care. And so they might pivot to a career in policy or a career in the law. And it's amazing to see how students grow and adapt and change their goals. And then I will say highlights of the program. We consistently hear from our students that our clinical ethics rotations are the biggest highlight of the program. The breadth of opportunity and the depth of opportunity in our clinical ethics rotations is not seen in any other program. And so that is a major, major highlight from students because they have such an array of opportunities. And I will say the second highlight is how students develop relationships with our faculty, our PhD students, our master's students, our undergrads, our clinical faculty. We get to know each other and we're able to provide great mentorship opportunities, and it really allows students to flourish both in our program and beyond. And we're very proud of those connections and also connecting them to our alumni network as well. So if you're interested in submitting a master's application, we are still open if you want to join us for this fall, starting in August. Students need to complete an online application. If you're interested in a fee waiver, please contact us. We require transcripts for undergrad and graduate institutions you've attended. Unofficial is fine for the application review process. We ask for a CV or your resume, 2 letters of recommendation. We ask for a statement of purpose. The statement of purpose is really focused on what's your interest in bioethics and medical humanities, and how does it potentially fit into your career path. Graduate test scores are optional. If you're an international student, there are some additional things that could be required if you did not attend an English-speaking university. And if you are a combined bachelor's master's degree student, these are undergrads at Case doing this program during their senior year. You would also need a PPOS form, which we can help complete. In terms of financial aid and student assistantships, we do have the opportunity for student assistantships. Students can fill a teaching, research, or administrative role within our department. And in exchange for the number of hours you're working per week, you receive a partial tuition waiver. It's about an average of $5,000 for the academic year, but it could be up to $12,000. We also have a wonderful financial aid department here at Case that can assist with any type of financial aid questions and the traditional financial aid options that students may be interested in. And if you're interested in learning more about the tuition information or fees, Grad Studies has that. So in terms of a timeline, we complete rolling admissions, so students are able to have a decision rendered by us typically within 2 to 3 weeks of when we receive a completed application. So at this point, the next major deadline for master's application is August 1st. That is our final deadline if you're planning on joining us this upcoming August. We have plenty of time and we have plenty of room for students. If you did submit your master's application by May 15th, you should have received your link for the student assistantship application, and that deadline is June 1st. And so that's kind of the timeline process we're looking at now. So I'm going to open it up in our last few minutes for questions. We did have a pre-submitted question that I wanted to answer. And one of the questions had to do with clinical ethics rotations. What if you are a student who has clinical experience and is joining the program? Is the clinical ethics rotations required, or what would they look like? So I will say that we do require at a minimum of 1 semester of clinical ethics rotations for all students, regardless of their clinical experience. And the reason is because clinical experiences, when you are in a nursing program or whether it's an RN, a BSN, a nursing assistant, you're doing a chaplaincy program or maybe medical school, those clinical experiences are focused on your clinical skills in your field. And in our clinical ethics rotations, our goal is to focus on the ethical issues that are seen in the clinical setting. And so it's important to us that students get that experience. If you have clinical experience, though, the number of hours can be reduced depending on how much experience you come with. So that's important to note. For students who are doing the health policy or the research ethics concentration, their second semester of rotations would actually be replaced with a practicum, some type of project focused on the concentration that they are in. So I hope that answers that question about those who come to our program with clinical experience. I will say, we've had even attending medical doctors do our program part-time over a number of years, and they get a lot out of clinical ethics rotations as well, even though they may have some of the most clinical experience of anyone. But because they're not focused so much on medical skills or clinical skills, they're focused on ethics, they do get a lot out of the rotations. So I'm seeing that someone else has submitted a question. Are there any specific requirements that need to be met in order to apply or request a fee waiver? Absolutely not. I will put up our email address, bioethics@case.edu. If you contact us, we can provide that fee waiver. We are happy to hand it out. The reason we don't include it in this PowerPoint or in this presentation is because the code can change year to year, and I don't want someone to use the wrong code if they are watching this maybe after this cycle has ended, but for future cycles. So feel free to reach out to us. The other thing I will say is when you email us, I am very willing to meet with prospective students. If you are unsure if this program is the right fit for you, sometimes it's a little hard to know, how does this program specifically enhance my career path? How is it going to help my resume or my career? And by having a conversation that's specific to your circumstance, it can help better understand how this program works, how it can be customized to you. And I think it's really important to highlight. And I'm happy to meet with anyone who's interested. And we can treat it like a pre-application screening, essentially. So I would encourage you, email us, bioethics@case.edu, as soon as you can, and I'm happy to meet with you and discuss this more. So I will say at this time, I'm not seeing any more questions, but I appreciate everyone who attended live or is watching the recording. Thank you so much for your interest on this topic and our Master's in Bioethics and Medical Humanities program. I hope you do consider putting in an application and joining us this fall. We strongly believe that having bioethics and medical humanities in your toolbox, in your skill set, is only going to enhance your career path, and whatever it may be. And so we look forward to reviewing your application and hopefully having you join us this fall. I want to thank you again, and I hope you have a good rest of your day.